Hello, my name is Eric Fan Yu Ling. Today I'm going to perform the HINGS thoracic and cardiovascular assessment. So this is my patient. Can you tell me your name and date of birth?
My name is Purnima Soni. My date of birth is April 7, 1982.
Okay. Are you happy today?
Yes, I'm
And
happy.
you agree, like, allow me to do the assessment?
Yes.
Okay, so you can see Purnima, her skin is appropriate, even tone, and are you happy?
Mm-hmm.
Yeah, so her move is very calm and collaboratory with me at this time, and skin wise, skin wise appropriate, dress appropriate. So now I'm going to start from the head and the face, and after that I will start with the eyes, the ears and nose to the mouth. So the head, I'm going to wear my glove. So do the hand hydrant with my glove. I'm going to palpate the head and also the scalp. So I'm going to start here, and then the back, the skull. Yeah, I didn't palpate any mass, and it looks very symmetrical, appropriate, round. It's good. The head, and then the face, right? Oh my god. The face, the skin, it looks good, and it's the skin, and then I need to do the eyes at the same time. Face, the skull, the face. Okay, so it looks symmetrical, same acro expression. It's good, like smile face, and I didn't see any like lesions, abnormal, no, like tubes, something. And then then can you raise your eyebrows, and then against it, and can you close your eyes, and can you smile for me? So everything it looks symmetrical, acro, and I didn't see anything abnormal when she blend, and then when she raised the eyebrow. So her nerve 5 and then 7 is present, and can you feel it when I touch it?
Mm-hmm.
So her nerve, the sensations, the facial sensation is present. And I'm going to palpate the temple pose. It's good. I didn't palpate any bruise, so it's normal. So now I'm going to do the eyes exam, the assessment. First I'm going to inspect the eyelid, eye brushes. It's good. It's very beautiful. It's across to each size. And then inspect the lacrimal, oculus, and then conjunctiva. It's good. Like it over here, it's good. And I'm going to use the light. This one. Thank you. Sorry about that. So I remember it's like you have to see over here the sinus. It's good. Can you see? Yes, it's good. And then the eyes. I'm going to do the corneal light reflex, and then later I'm going to do the cover test. So it's good. It's contrast and constricts. And this one too, it's normal. need to do the cover and cover size 5. Before that, let's do the reading test. So let me see if her reading test is normal or abnormal. So Pranima, can you read this line for me?
LTFPH.
And before that, I need to tell her to cover one eyes. So can you cover the right eyes for me? And can you read this?
LTFPH.
Oh, okay. And then now you turn to cover the left eyes. Can you read this one for me?
CFDHJ.
And also this line.
LTFPH.
So her right side and left side eyes is 20/over 20, so which is normal reading test. And now I'm going to also tell her to cover the eyes, cover and uncover eyes, and then we're going to do the test. So you cover the right eyes for me, and I'm also going to cover the right eyes. And can you read this number for me?
2, 4, 2, 4.
Okay. Now switch to the left eyes and read this number for me.
2, 4, 2, 4.
Okay. So her test is normal finding. Cover, corneas, head, positions, it's good. I'm going to do the fundoscopy exam. This is the one, right? Let me see. Okay. I'm going to do the, the optical nerves and also the retina. It's present or everything is good. Good. So look at the, so it's good. Like I can see the optical nerve and the retina is present. Okay, it's good. And this one, optical nerves, retina backgrounds, optical. This is also present, and the scala I forgot to do. So I'm going to press down the eyes. It looks white, it's good, like normal. I didn't see any lesions, abnormal finding. Now I'm going to move on to the ears. So right now, first I'm going to inspect the precision, the size, the shape, and the symmetrical. So her right eye, ears, it looks good, first of all, and there's a beautiful earring. I'm going to look at the left eye, left ears. It looks good. It's nice. And I'm going to palpate the ears. And the peanut. And so her peanuts and the trigus, it's good. This one, I didn't touch. I didn't feel any abnormal finding, the mass or the lesions. And now I'm going to do the ears. Then going to inspect through the optical scope. What am I saying? I don't know. I'm going to look at the ear canal to see everything is good. So the right eye, the ears. So I see it's brown. I see the membrane, it's good, intact. And from this side, I can see the membrane, and it's good. It's intact. I didn't see any like drainage coming out. Everything is normal. And I'm going to do the 3 tests. First, there's a Weber test, ring test, and whisper test. So I'm going to do the whisper test. So I'm going to cover her ears, and I'm going to whisper words. So if she can hear it, that means it's normal finding. Like she can hear me.
Apple.
Okay, it's good. So I'm going to do another one.
Banana.
Okay. So it's normal finding. So next one, I need to do the wiper. Wiper. This one. So I'm going to feel the if she can feel the vibration of the from her what's this called, the head. It's the Can you feel it? Okay. And now I'm going to do the ring test. That means I'm going to put the what is Turner fork to the yes, and then behind her her ears, and then I will tell her to when to stop feel the feel the vibrations. Give me 1 second. Let me know when it is stopped.
Stop.
Can you hear it? Okay, good. It's more finding. And now switch to another ear. Tell me when it stopped.
Stop.
Okay. Can you hear it? Okay, it's good. Now we're done for the ears part. Now we're going to move on to the nose. So first I'm going to see the nose, inspection the shape, the symmetrical, and the skin. The skin, I didn't see any abnormal color, and it's very symmetrical, and didn't see any abnormal lesions, drainage, redness. And then I'm going to palpate it, the bridge and the tissue. So her nose, I didn't palpate any mask and abnormal finding. And now the nose, I'm going to palpate the sinus, and I'm going to inspect the nasal cavity and the nasal septums. So I'm going to use this. Right. Yes. So I'm going to tell your head. I'm going to see your nose. It's good. I didn't see any finding. Like I can see the septum, it's present. It didn't see abnormal, and then I didn't see any obstructions like blockage over there. Palpate the sinus, and I'm going to palpate the sinus. First, it's the frontal sinus. It's good. I didn't see any, like I didn't palpate any abnormal nodes. It's coming out. And now I'm going to palpate the maxillary sinus. It's good. And did you feel any pain?
No.
Okay, how about your frontal sinus?
No.
Okay, good. Thank you. And now I'm going to test the sense of the smell. Like I want to make sure the cranial nerve first, the one is present. Smell. I'm going to use the perfume to make sure she smell anything.
I can smell it.
Good. Now let's move on to the mouth and the throat. First, again, we're going to inspection the skin, and then we have to look at the lips, and so her lips is good. I didn't see any very dryness, membrane, anything in the lips. I didn't see any crack and any abnormal lesions. And I'm going to expand the membrane, mucous membrane, the mouth, and I'm going to see the soft and hard palate. Yeah. And I'm going to use the light to see. Yeah. Her membrane is pink moisture. And the D is good. The present, I didn't see anything. And the hot palate, yeah, can you tell me? The hot palate, everything is good. And can you move your tongue out? It's good. And can you also move out your tongue up? I can see the gland over here. It's good. Yes. And can you for me? Yes, I can see. What is this? It's present. It's very symmetrical. The tongue, so it's good. So palate is good. And then I'm going to the gag reflex is the cranial nerve 9 and 10. And did you mind I do the gag reflex? What you are okay to just?
I'm fine. I think I have gag reflex.
Yes. Okay. And I'm going to let her test the exactly to see her. She tests anything or she lost the test. Okay. Thank you.
Thank you. It's sweet.
You can taste it, right? So her test is present. And now I'm going to move on the neck. So I'm going to palpate the lymph nodes, the karate pose, and tracheal positions, and palpate the thyroid. And later I'm going to auscultate the thyroid and the carotid artery. So palpate the lymph nodes. So I'm going to start from the below the jaw over here. I didn't feel anything. I'm sorry, my hand's cold. And also behind the ears, and going down like this to the neck. It's good. I didn't feel any abnormal mass and the swallow nose. It's good. Lymph node, and then going to palpate the karate pose. Here it's present, and another one over here. Okay, it's present, and now I'm going to assess the tracheal positions. Tracheal positions here. It's normal, and it's in the center, and it's good. And can you swallow for me? Yeah, I can see the swallow reflex. It's good. And now I'm going to auscultate the thyroid and carotid artery. so I can hear there's no bruise, and it from the both side, and the trachea is also present. I didn't see any bruise. Now I'm going to do the chest assessment. Can you turn back to the chest? Thank you. Chest. So I'm going to do over here. Our chest. It's good. Sorry, I'm going to start from the post of the chest, and then I'm going to do the I'm going to expand the skin. It's good. And can you breathe for me? One more time. And another time. Yeah, I can see when she breathe in and breathe out. It's good. I didn't see any abnormal symmetrical finding. And then I'm going to do the tactile frequency test. So this time I need to feel the vibration when she speak 99. So I'm going to tell her to speak say the 99 every time. Okay. So Purnima, please, right now I'm going to do the test. So every time you have to see the 99.
Okay.
Yes, thank you.
99, 99, 99, 99, 99, 99.
Okay, so I can feel the both side. It's present the vibration when I palpate to do the test, and I'm going to do the percussions. Okay, I didn't hear any abnormal sound finding bilaterally through his her lung field. And now I'm going to ask the lung sound. Okay, take a deep breath. So I heard the sound. It's present, and I didn't hear any abnormal vascular sound like crackles, anything. It's heard lung fill from top to bottom. It's very clear. And I'm going to do the anterior chest also. So can you turn back to me on this side? Thank you. So first, you also going to inspect the shape and symmetric. So just a normal breathing for me, so you can see it's a grow, and then it couldn't see any abnormal finding. And I'm going to assess the respiration rate. 15. Her respiration rate is 19, and then when I look at the pattern, it's normal. I didn't see which one's faster and which one is lower. And now I'm going to palpate the chest. Okay. Do you mind I palpate the chest? Okay, thank you. It's good. I didn't see any abnormal lesions and the mass. And now I'm going to ask the anterior lung sound. I'm going to breathe in and breathe out. Okay, take a deep breath. Okay. Yeah, her lung field it's present, clear from both sides, and I didn't see any abnormal finding. And now I'm going to move on to the heart. So first I'm going to assess the JVD inspections. Okay, this is so now I'm going to tell Purnima to lie down so I can see assess the JVD. Thank you. I'm going to have pencil and the ruler. And then can you turn toward out another side for me, the head? Symmetric. So I can see JVDs here. First, the palpate, it's good. I didn't see it's present over here. It looks like 1 centimeter, so it's also in the normal range. If it's greater than the 3, it's abnormal. So then we have to do the further assessment. And now I'm going to move on to auscultate the heart sound in different field. So I heard every S1 and S2 present in all different area, and so present, and I didn't see any skippy or any abnormal finding. And now I'm going to inspection and palpation of the upper and lower extremity, the pulses and circulations. So I'm going to assess the arm, the radial pulses. Okay, it's present, it's normal. And now I need to do the brachial pulses. Okay, it's present. And now I'm going to see the circulation of the hand. It's less than 2. So every finger is less than 2. It's good. Now we're going to move on to the left hand. Thank you. the radial poses. It's present over here. The brachial. It's present. It's good. And now for the circulations, it's present. It's less than 2 seconds. And looks good. And the hand, both sides, it's warm. So her skin. And now we're going to move on to the lower extremity. I'm going to palpate. Yes, I'm going to palpate for parietal pulses. Okay, it's present. And okay, and then going to do the over here. It's present in your pedal poses. It's present, and she have the nail polish on her toes, but I can feel her toes and the feet. It's warm and didn't. So I believe it's present for the circulation part. It's good. So I'm going to do another the left side. Popsicle poses present over here, and from this side, this pose it's present too. And last one, the pedal pose. It's present. And this leg, the feet, it's good also. It's warm. It's I didn't so I believe the circulation is good. Okay, you can sit up. So this is my end of my assessments. Thank you. That's it. Okay.